Hi everyone, welcome. We're going to get started in just a minute, so we'll give everyone a second to get in the webinar. Okay, I think we can go ahead and get started. Next slide, Andreas. Okay, welcome everyone to the ISOHA Africa Community Building Meeting. That is what it is supposed to say on this slide. We are very excited that everyone could join us today. Next slide. So I'm Bailey Archie, and I have worked this past year as the Educational Committee Event Manager, and I am about to transition into the role of VP Education. These are your Africa continent reps on the left side of the screen. I think that they both had situations precluding them from attending today, but Andreas has been the Vice President of Education this past year and is now stepping into the President role. So Andreas, if you want to introduce yourself.
Hello, everybody. I'm happy to be here with you today, and I'm happy that you are all here to make this conversation happen. As Bailey said, I'm the Vice President of Education of ISOHA for the previous year, and the upcoming year I will be the President of ISOHA. So the purpose of this meeting today is to talk each other, to meet each other, to interact, and see what we can all together do in your continent. So, so my personal point of view about Africa, uh, I'm European, so I'm not from Africa. I don't have big experience of your way of life there and of what you are doing scientifically. But I have seen that from my experience, it's the best continent according to One Health education. I see a very nice future on the One Health idea there, and I see that you expand a lot and you do new things there. So don't hesitate to talk today. Don't hesitate to raise your hand anytime you want to say something and interact and meet each other. Thank you for coming.
Great. We can go to the next slide. I'm not seeing the next slide. Is there may be a little bit of a delay? Oh, there we go. Great. So this is just an outline of the things that we're going to talk about today. We haven't done the break in the past few webinars that we've had just because they have flown pretty well, and it hasn't been very long that we've been in the webinar by the time we get to that point. But if you have any suggestions on that, feel free to put them in the comment box when the time comes. So these are the things that we are going to be talking about, and we can go to the next slide. So we first just wanted to talk a little bit about ISOHA. So the International Student One Health Alliance is a umbrella organization of the One Health Commission. And the goal of ISOHA is to connect student groups worldwide who are working in One Health. So these are just some pictures of events that we've been a part of or sort of facilitated over the years. Next slide. So we have our outgoing executive committee. We are currently in the middle of rotating executive committee positions to better fit EXCO members' strengths. So this is our previous EXCO positions. Next slide. Oh, if Yusuf is here, he could introduce himself. Okay, I don't think he's here. Okay, and then these are our incoming EXCO officers. And Andreas has introduced himself already. And I've introduced myself. Dauda, you can introduce yourself. If you unmute yourself, you should be able to speak now, Dauda.
Hello, everyone. Can you hear me?
Yes.
Okay. So, hello, everyone. My name is Dauda Ayomide Onawala. I'm from Nigeria, and I'm currently a DVM intern. Last year, I served in the education committee for ISOHA, and this year I will be serving as a co-vice president on marketing. Thank you.
Great, thank you. And Samantha, go ahead.
Hello, hi Bailey. Can you hear me? Am I audible?
Yes, sounds good.
Oh, thank you. So I'm excited to be here. I am Samantha Mkonja, a medical student from the University of Nairobi, Kenya, currently serving as the co-vice president of marketing, and I am excited to be here. Thank you.
Great, thank you, Dauda and Samantha. And these are your ISOHA continent representatives. We have them shown for all of the continents here, but for Africa, your representatives are Isaac and Elikana. Next slide. And if you would like to get in touch with your continent reps, you can reach them at this email address, and they would be happy to help you. And this is a map that shows One Health student groups from around the world. So as you can see, there are many in Africa, which is great. And if you want to go see this map, you can visit it at this link, tinyurl.com/ISOHA group map. And we also have a map of educational opportunities. So degree programs, internships, summer programs, that kind of thing. And you can visit it at tinyurl.com/ISOHA map. Okay, so we're going to move into student group introductions. So student group representatives that are here today, we would love for you to introduce yourself and give a maybe 2 to 3 minute overview of your club and the activities that your club does. So I'm going to look through the list of people who signed up on the Excel sheet as student group representatives, and I will call on you if I see that you are here. Okay, Nabila Raja. You can go ahead.
Okay, thank you very much for unmuting me. Hi everyone, my name is Nabila Raja. I am a fourth year veterinary student at the University of Pretoria's Faculty of Veterinary Science. I'm here today representing the IVSA, so the International Veterinary Students Association. I'm the vice president there, but the new baby of ours that I'll be representing is One Health OP. OP just stands for Onderstepoort. It's the area that our faculty is in. I'm here to showcase possibly at some point what we do. One Health OP, we realized earlier this year that there was a need to focus on One Health, and we're very blessed at our faculty that we have a module somewhere in our academic course on One Health as well, presented by the faculty. One project that we're incredibly proud of is our Maverick initiative. The name is just called Maverick, but it's a One Health collaboration between our veterinary and medical students that happens a few times a year, where we are trying to start a One Health approach and bridge the gap not only between medical and veterinary professionals, but between sort of a little bit of students from each faculty of our university, because I think that we have to also move past this idea of the One Health triad, human, animal, environment, because I think it's quite simplistic and there are so many levels to One Health that we need to understand as veterinary professionals, but also as healthcare professionals and every other professional out there. So it's lovely to meet you all. I'm so happy to be here today. Thank you very much. It's a huge privilege, and I look forward to lots and lots of conversations later on.
Great, thank you. Okay, Simon Peter Oteba. You can go ahead, Simon.
Hello everyone. Good evening. This is Simon Peter Oteba from Moi University in Kenya, representing the One Health Club in Moi University. Moi University is one of the members of the One Health Central and East Africa. So in our institution, we have members from schools of public health, the School of Dentistry, medicine, and School of Nursing coming together to join this club. So personally, I'm a fourth year student in the School of Public Health, taking a Bachelor of Science in Environmental Health. So we normally participate in outreach activities, the primary healthcare activities in communities around in Kenya especially, and then we also participate in One Health field attachments to demonstration sites alongside our community outreach activities. So currently, during this pandemic, we've not been able to actually go out to the communities because of the restricted movement and so on. But then we are laying a plan to be able to mitigate such misfortunes in the future. So thank you, and I'm happy to be here today, and I hope for interactive session with you all. Thank you.
Great, thank you. Could you tell me the name of your school one more time so I can write it down?
Yeah. Moi University from Kenya.
Okay, great, thank you. Okay, and Moyanolua Oladoye, if you unmute yourself, you can go ahead. You're still muted. There we go.
Can you hear me?
Yes, I can hear you.
Okay. Good evening, everyone. My name is Moyelu Oladoi from the University of Ibadan, Nigeria. I'm the team lead of the One Health group here, and the One Health club here has over 20 members. And the club started its activities May last year, and so far we've been able to engage the public through social media campaigns and also community outreaches. Last year, we had 2 major outreaches to secondary schools in Ibadan. And through that, we were able to communicate with high school students on how to stay safe from rabies. That was in commemoration of the World Rabies Day 2019. So, but since the pandemic started, we've not really done much as regards community service and community campaigns, but we've been actually working around social media campaigns. We've been actively doing that since the pandemic started. So I'm glad to be here today, and I hope to network with like minds on moving the club forward. Thank you.
Great, thank you. Okay, I believe that is everyone who was signed up on our list who is present. But if there are any students here that have not yet introduced themselves, you can raise your hand and we will unmute you. Okay, Duke, you can go ahead.
Thank you. Good evening, everybody. My name is Duke from the University of South Africa. I'm a PhD student in physics. I'm a Kenyan student here in South Africa. I'm new here and I'm learning the activities of ISO, and I intend to join. I'm excited to join you today. Thank you so much.
Great, thank you. Fokang Armand, you can go ahead. Just unmute yourself. Okay, is there anyone else who, oh, Neil. Neil, you can go ahead.
ISOHA And I'm just really interested to hear what everybody has to say, and really excited to hear about all the different groups that are here and what you all are doing.
I think we missed the first half of that, Neil, if you want to say that again.
Can you guys hear me now?
Yes.
Excellent. Yeah, I'm Neil Vizeau. I'm a trustee with ISOHA, and I'm just really excited to hear and learn from everybody else who's here.
Great, thank you. Okay, Nitji Shabangu, would you like to introduce yourself? I see your hand's been up for a while. You can go ahead.
Hi, everyone. All right, thank you. My name is Nji Shabangu, preferably Angie or known as Angie. I am from South Africa. I'm a former student at the Faculty of Veterinary Science at University of Pretoria. And I'm currently in the private sector. I'm working for a bioinformatics company, and my interest in One Health basically is to build relationships across the continent. Mainly in developing K-12 curriculums, trying to implement the One Health curriculum within the school curriculum across the continent. So I just need to build relationships, and yeah, hopefully we can all communicate and build long-term networks.
That's great, thank you. Okay, Samantha, you can go ahead.
Hi, once again. So I'm Samantha. I also serve as the president for the Students One Health Innovation Club, College of Health Sciences at the University of Nairobi. So currently the club has students from 6 faculties, from med all the way from med, dentistry, pharmacy, med lab, nursing, etc. So in terms of activities, as you can see in our name, we have, of course, activities related to One Health. And in addition to that, also activities related to innovation, but still within One Health. So some of these activities include community outreach, which we do collaboratively with Moi University, where Simon presented, and vet school from the same university. We also do medical camps. We do school outreach, and where we give education to at least primary and secondary school students. We also, through OSHARE, do or participate in demo sites field training, as well as case competitions. Yeah, thank you, Bailey.
Great, thank you. Samia Bakare, would you like to introduce yourself? I'm trying to unmute you. The system is giving me trouble, but Samia, you can type in the questions box if you would like. Timothy Ojodare, if you unmute yourself, you can go ahead.
Can you hear me? Good day. I'm Timothy Ojidari. Can you hear? All right. From University of Ilorin, Nigeria. I'm a final year veterinary medical student, and the One Health initiative has started here, but still taking baby steps. However, for the past 1 to 2 years now, we've been actively involved with the World Rabies Day and the World Tuberculosis Day, where we conducted um, uh, public awareness in markets and market streets and just generally publicly, just the prevention and the control. So far we haven't done so much, but with ISOHA, I think we can get things done better and with more information. Thank you very much. I'm excited to be here.
Thank you. And can you say the name of your club and school again, please?
That's as a One Health. The name is not so just a One Health initiative group of students. Not. What do you mean by that?
Just if your student group had a name, but yeah, One Health Initiative group of
Yeah,
students is fine.
UniLoci. That's UniLoci. That's University of Ilorin One Health Students Initiative. That's
Okay, great.
University
Thank
of, yeah. Thank you.
you. Okay, Taya Yeshibina Jegede, you can go ahead if you unmute yourself. There we go.
Hello, I'm Jagede Sibina from University of Abuja, Nigeria, in my 5th year. And currently there's no any One Health Club or ILSA here, and I'm happy to learn so that we can start one here. Thank you.
Thank you. And if you could put your school name in the chat box, that would help me out, or in the question pane. Thank you. Okay, and Yahaya Musa, you can go ahead. Just unmute yourself. There we go.
Okay. Hello, can you hear me now? Hello. Hello. Hello.
We can hear you, but there's a lot of feedback.
All right, all right. Hello, my name is Yahya Musa from Nigeria, and I am a fourth year veterinary student. And honestly speaking, we don't have a One Health Initiative club in my school, but because the way things are going up here, I think soon I would propose that to my school.
Okay, thank you. We had some trouble hearing that, but if you want to type it in the question box, I'll be sure to make a note of it. Okay, is there anyone else who, okay, Samiat Bakare, you can introduce yourself if you'd like. I see your hands raised. Oh, we had trouble unmuting you. Andreas, do you want to try to unmute Samiat? I'm not sure why it won't let me unmute him.
I face the same problem. I can't.
Okay, I'm not sure why it's doing that, but Samiat, if you want to introduce yourself in the chat box or question box, that would be great. Latifa Abdul Karim. You can introduce yourself.
Hello, good evening. Can you hear me?
Yes.
Good evening. My name is Latifa Abdul Karim. I'm a student of the University of Ilorin. I'm a final year veterinary medical student, and I'm also the president of the University of Ilorin Students One Health Initiative, UNILOSOI. At UNILOSOI, we try to promote One Health education. We actually established about 2 years ago, a year plus, and we've been trying to gain ground because there is little to no One Health perception around here. And I think we so far are the first student group officially instated in the country. So we're trying to gain ground, and our main aim is to promote One Health education. So our programs are channeled at creating awareness about One Health to our members. We also try to have some activities on innovation, where we're trying to create a monthly challenge where our members actually try to bring up new ideas that can work for One Health or to solve One Health problems here, just so as to create more awareness about it for them. We have members in about 6 faculties so far: pharmacy, medicine, life sciences, microbiologists, and biochemists there. We also have members from medicine here. We have members from some of the anatomy and physiology departments as well. And we also engage in outreaches. We engage in some of the health days outreaches like the Antimicrobial Resistance Day, One Health Day, and World Tuberculosis Day. But so far, we're just trying to create a lot of efforts to make sure that the One Health initiative is promoted around here. And with ISOHA, I think we'll be able to get there. It's a pleasure to be here. Thank you very much.
Great, thank you. Okay, Elikana, you can go ahead.
Hi all. Yes, can you hear me?
Yes.
Can you hear me? Yes. Good evening good evening everyone from Uganda. You guys are doing great job. Thank you for reading. My name is Erekana Nduhura, and I'm a medical student at Mbarara University of Science and Technology. That's in southwestern Uganda, and founding member and club secretary for the Students One Health Innovation Club at Mbarara, and basically the current continent representative for Africa with Isaac from Ivory Coast. I've been in this place for the last 1 year. I'm working with a first executive, and around Africa, basically I've seen a tremendous one as a student engagement, basically from Kenya, Rwanda, Cameroon, Ethiopia, and they have been doing great job. Nigeria, as those who have registered will be sharing with you most of the things that they have been doing. And in the meantime, I might share some of the things with Samantha. She will share some slides of information of most of the clubs, what they have been doing, especially in the COVID situation. And yes, I would wish every other person here the best discussion. Yeah, today I had trouble, my electricity is off in Uganda and my device can't connect well. So I'll be following closely, but later I may disappear along the way. I wish you a nice discussion.
Great, thank you. Okay, Yahaya, okay, yeah, Yahaya introduced themselves, I believe. Okay, I'm going through and looking at the other Hands raised. Okay, we'll have time for just a couple more introductions. Joseph Andara, you can go ahead.
All right. Good evening, everyone. My name is, can you hear me, please?
Yes, I can hear you.
Okay. My name is Andara Joseph. I am a veterinary student from University of Jos, Plateau State here in Nigeria. And I am a member of International Veterinary Student Association Nigeria and University of Jos chapter. I am also an active member of Association of Veterinary Students here in the faculty in University of Jos. And we have held a number of conferences. Recently, we held a conference about managing pandemics, the veterinarian role. And in that, we also talk about the One Health initiative, where we try to share ideas, how we can collaborate, and how we can work with um, other students from other faculties, just as someone mentioned, the one from medical sciences, human medicine. They held a conference, the Standing Committee on Public Health, that's for the human medicine. They held a conference sometimes last year, and some of our colleagues were also part of it because we tried to reach out to them to introduce to them the One Health initiative program, which is going around globally. And they gladly accepted and they opened the doors for us so that our members too could attend the conference so that we can collaborate more. And we haven't yet have a strong committee here in my chapter actually about the One Health initiative, as some other people have mentioned about the clubs they've set. But we hope to actually bring that soon because the International Veterinary Student Associations are really doing a great job. And we are currently planning on a, a conference that's an international conference here in Just will be hosting. So in that, we hope to inculcate such initiatives of the One Health program. And I will be glad to be enlightened more about some of the campaigns some other people have run and how you've been able to achieve such successes. So I'm glad to be here. Thank you so much.
Great, thank you for sharing. So we're so glad to have so much participation in this webinar. We're going to have to move on to the part where we talk about student life in the COVID-19 pandemic. So if you didn't get to introduce yourselves during this section, you're welcome to introduce yourself if you have something to share about student life in the COVID-19 pandemic. So next slide, Andres. So basically, we would just like to know what are the main challenges each organization is facing after the COVID-19 outbreak. How have the leaders of the organization managed themselves and the organization during the outbreak? How have decisions been made? And what steps are the organizations intending to take in the future in order to minimize the negative effects of COVID-19 of the crisis on their organization? So I'm going to put down the hands that were previously raised just so I can know who has something new to say to this point. Okay, so now if you have something to add about student life in the COVID-19 pandemic, you can raise your hand. Okay. Abu Bakar, you can go ahead. Just unmute yourself, please. Okay, we'll move on to Joseph. You should be able to unmute yourself now, Joseph, on Dara.
Okay. The COVID-19 has actually posed a huge challenge to the student life. Actually, it came actually like a pause to various activities, the student life, the study, and everything. So, amidst the COVID-19, it has also opened up some opportunities to be able to explore other options of learning and engagement in other activities, because so many webinars, so many conferences have held online, and so many ideas have been shared. And I have participated in a number of conferences, which actually were so huge, and even those outside the scope of my own discipline. I remember participating in a conference organized by medical students of the Faculty of Medicine here in University of Jos, where they spoke about legal uh, options, legal incidences, legal cases that has to do with practice of medicine here in Nigeria, and other global issues that were discussed, and it was so enlightening. So I see the challenge of COVID-19 in a negative way, which has hampered the progress of the studies, but yet I see it as an opportunity and an avenue to explore other options of learning, other knowledge outside one's discipline. And I have also engaged in a number of skill training to learn uh, new um, new skills, new like I engaged in computer graphic tutorials, and a number of them that have held on. So COVID-19 has come with challenges, but it has also come for opportunities for one who is ready to explore. Thank you so much.
Great, thank you. Okay, Abu Bakar, I see that your hand is raised again. You can try to speak if you unmute yourself. Okay, Taya Sibana, you can speak if you unmute yourself. Okay, Alakana, go ahead.
Yeah. Concerning what the pandemic has caused for organizations, it has actually hindered lots of physical activities a whole lot. because as the regional representative for the Sub-Saharan Africa in IFSA, when I usually have meetings with member organizations this period, there's literally no activities done because of social distancing, schools are closed. So actually the pandemic has really caused a lot of hindrances to physical activities, and messages can still be passed through social media. That means that more focus should be placed on online activities, social media promotions, and activities to create awareness to people concerning One Health. I think that will also go a long way. Thank you.
Great, thank you.
Can I speak?
Yes,
Can I?
Alakana, go ahead.
Yeah, thank you for the wonderful discussion and exploring what each and every other person is going through as per the COVID situation. Basically, life here in Africa, the clubs I've been reaching out to, and even my own club, it has been hard to conduct the projects that students had started, especially given the fact that most of the countries here had lockdowns, which are still going on, and students went home. Actually, most of the people in Africa like study when they're at school, so once they go, then they will have gone home, because basic access to internet is a big issue. So for example, looking at my club, we started the Students Against COVID initiative, which was actually a One Health initiative. Look at the perspectives of human health, animal health, and then the environment health, where I wanted to get students from each section. Then they give us insights on how best we can handle the COVID situation using the triad approach, the human health sector, the animal health, and what we can do for the environment, so that we can counter the problem. But then where the problem comes from is that very few people were willing to go in for the project, because it was going to be an online interaction where it required internet, it required time for people to commit. So it basically became hard. So a few of us, basically me and a few of my colleagues, we did this work, shared the poster that we did, which I will share with Samantha. I hope she'll be able to get at the screen for screen sharing, so that each of us can see the project actually. Then I was reaching out to my friends in Rwanda. They obviously they had the same challenge, internet, especially time, committing time to the something that is online, was actually a big trouble, given the fact that most people who are doing their final work for academic school were also busy. When, for example, someone is doing research at home and is busy, they tell you this and that. So something like that. Then there are people from other of the countries, like now, like Kenya. I think Kenya, my friend Samantha and the team were somehow safe, because the current initiative that we have in Africa, we have something called share, which is actually one Central and East Africa, that is soon becoming AfroHun, that is African University Network, that has a sister chapter in Asia. So this very organization has people that read at university. They're called faculty read. So Kenya was lucky to get a faculty read who were working with the country task force. So these people were actually on ground. They engaged with students, and students have been getting initiatives. So I feel my friend Samantha will share with you some of the nice project that Kenyan students are doing, but those ones were really helped by the people that were able to coordinate them. So in Africa, the most of the challenges come from people going home, and because once they go home, then they focus on other things, they lose track. So it is very hard to actually mobilize for an online activity. And so from this background, what would be the way forward that I can give people here? that have come to discuss the progress of ISOHA regarding this COVID time. So one, personally, I've been able to do a number of good things for One Health using this time. And what is important now is to connect with the people. The little time you get, you need to get internet. So we have to invest in this work. So get internet, invest time, convince your friends where possible. You can buy internet for some people, because when I want to do some things, actually I tell someone, they are like, internet. I'll be like, okay, I'll put you on my to govern something they go to govern, never mind. So I connect them, then we do something, they help me, then finally we do work. So you have to be you, invest in yourself, get internet, then convince friends who will now allow you buy your idea, then they support you so that you can keep the thing running. Then too, there are faculty, the university elders or people who mentor us, who are willing to guide in some of this crucial time. So, and those are the people that have been in One Health work, and they are willing to help. So where things let you down, then seek advice, like seek guidance from those people. They can come in for you and rescue you at some point, because these things really sometimes give you trouble. Then lastly, in the COVID time, there is something that you have to maximize every opportunity you get. But of course, not forgetting giving yourself time, because COVID has been disastrous. So mental health challenges are here. Please, if you feel like you're breaking down, ask a friend, hey, crack a joke, and then everything will be in order. Because one thing I have to tell people is that One Health work is really broad. So you have to dive deep every other day and get like-minded people who are into this One Health initiative. They will give you fresh ideas every other day, and we'll keep moving. Please keep up the work. I like the discussion. Continue engaging. Thank you.
Great. Great, thank you. Is there anyone else who would like to share about student life in the COVID-19 pandemic? Okay, I see Abdullahi, your hand is raised. You can go ahead if you unmute yourself.
Hello, everyone. Can you hear me?
Hi, yes, we can hear you.
Yeah, to introduce myself, my name is Abdullah, a postgraduate student at University of the Free State, South Africa. Yeah. So basically, talking about the impact of the pandemic on students' lifestyle, the economic burden, and perhaps the global impact generally. It's no doubt that many schools in Africa do not have, the facilities to cater for learning, remote learning, distance learning, and virtual learning outside the university campus. And these as a result lay a huge burden on students, because many students cannot proceed with their academic sojourn as a result of that. So, and nobody has idea of how long the pandemic is going to take. So these has like just caused a sudden pause in their activity, and they have to wait. Whereas in some places, like there is room for virtual learning, and students immediately have kicked up with their academic activities after some weeks. Yeah, so that's the first thing. And secondly, I want to look at the psychological impact as well, because if you look at it now, a lot of people are in the so-called quarantine, people going through cycles of depression, going through cycle of let me say hyper depression, because they have no one to like engage with, they have no one to like go around with, because some people they get their energy from outside, they get their energy externally. So I feel like there should be a lot of campaigns, courses, and sensitizations on mental health to at least improve our people in our isolation. Talking about the economic burden posed by the pandemic, it's like enormous. Like no one is gonna doubt that. Like even looking at it from the global scale. So I don't know how ISOHA can help, but I feel like there should be ways to like engage the government, the sponsors, to at least try to help those that don't have enough with palliatives, and also with at least money for them to cater for their economic lifestyle. So finally, I would want to like also look at the advantage. I also want to talk about the advantages. Like the first speaker said, like in as much as the pandemic has a lot of disadvantages, we can't also shy away the advantages it has, because I feel like there has been this unprecedented acceleration in a lot of things. Look at how virtual learning has been accelerated. Like nobody believed that things can be accelerated up to this extent. The internet have become to some extent better than it used to be. Like there is use of robotics technology now in different parts of the world. So it shows us that we have the capacity, we have what it takes to get to the future, but it's just appear as if we are waiting for something to trigger that. And I feel like this pandemic has triggered that. And I feel like it has shown more advantages than its disadvantages. And I feel like if we can learn from the lessons we get from the present pandemic, we should be able to have a more fecund and productive lifestyle in future. Thank you for hearing from me, and I'm glad to have everybody engaging. Thank you.
Great, thank you. And we can take one more comment on student life in the COVID-19 pandemic. Okay, Jaber, you can go ahead.
Hello. Hi, can you hear me?
Yes, we can.
This is Jaber Belkiria. I'm actually representing One Health Workforce Next Generation, and I'm working with OSHA / AfroHun now. And I'm very happy to hear your voices and to hear that you've been active during the COVID-19 pandemic. I'm actually very happy that ISOHA is doing these series of webinars. This is a great time to connect and network with everybody. I personally, during the COVID-19, learned a lot from my friends. So I've been connecting with friends that are in other disciplines, and we've been brainstorming and learning from each other about ways that we could deal with COVID in our country. I'm originally from Tunisia, so I'm African as well, and I live in Tunisia. And we've been writing a series of articles, and we've been advising the government in Tunisia about COVID during the confinement. We also launched a challenge, which is digitally raising awareness about COVID-19 in both networks, so both AfroHun and SIAHun, and we've received a lot of submissions. So a lot of posters, a lot of videos, a lot of comments about how to raise awareness in the communities, and I've seen some of the universities here, representatives of universities or clubs have participated in this competition, and I would like to thank you, and you will hear back from us very soon. Thank you very much.
Great, thank you, and thanks for being here, Jaber. Okay, we're going to transition into the next section now, and I believe Dauda is going to speak.
Hello once again. Can you hear them? Hello.
Yes, we can hear
Sorry,
you.
am I clear? Am I clear now?
You are
Yes, you
clear,
are.
definitely.
Okay. Thank you so much. I thought it was breaking. So thank you everyone for the interesting discussion so far. So we understand the COVID-19 has had negative impact on our operations, especially physical activities. But then before COVID-19, I would like to ask the representatives of student organizations that are here how they are faring with our partnership and their income, like how are they managing finances. So I'll be asking some questions from each and every student organizations that are represented here. But then if there are more than one representative that came for this meeting, it will suffice for only one of them to answer the question. So if we have more time, then definitely every other person can contribute. So the first question would be, how do you guys source for fund? Do you have a membership fee? Like, do you charge your members a certain fee annually, monthly, and so on and so forth? Would like to know so that we can help um, other students that are interested in starting up One Health student organizations in their universities, in their localities, and so on and so forth. As we can see, we also have people like that here. They would like to start up, but they don't really know where to pick it up from. And yeah, getting all these informations will help everybody get better at what they are doing to help the One Health cause generally. So I would like you guys to start answering the question now. Do you have membership fee? Like, do you charge your members membership fee? And if you do, how much is it in your currency? So if you want to talk, you can just raise your hand. So Andreas will unmute you so you can talk to us.
Yeah, I see a hand from Yasser Hamza, so I will unmute you.
Yes.
Now you're unmuted.
Hello. Yes. I'm
Hello.
sorry. I had raised my hand for the COVID-19 and students.
Okay.
Yes. Yes. Sorry.
So
Right.
let me check the rest. Okay, Simon Peter Oteba. You are unmuted.
Thank you. Hello, everyone. Once again, my name is Simon Peter from Moi University. I represent the Students One Health Club from Moi University in Kenya. So regarding the sourcing of funds, our club charges a membership fee on registration of 200 Kenya shillings, which is equivalent to $2. So we also, when we organize most of our field activities, we normally award a certificate of participation to all those who attended the event. And so we charge a small fee for the certificate of about $1, equivalent to $1. And those funds we normally take to help and support our activities and the club at large. Thank you.
Oh, that's quite interesting. Thank you so much. I think Uniloshi, University of Ilorin, you guys are quite established from what I've heard so far. How do you charge membership fee and how much is it? The student group from University of Ilorin, can you? Okay. I don't know if you guys get the question, but someone just answered it. I think that would also help in understanding the question. I actually asked for what you charge in membership fee, how much is it, and that's all. So I don't know if any other person wants to talk, especially the established student groups. Samantha, do you guys charge a membership fee in Kenya, and how much is it?
We have a hand actually. It's
Okay,
from
who's that?
Luva Oladoye. Sorry, my
Okay,
pronunciation.
the guy from University of Ibadan. Oh, you can unmute him.
Yes. Hello, everyone. Can you hear me?
Oh,
Yes, we can hear you.
Okay. Actually, presently at the University of Ibadan Students, One Health Students Club, we don't charge any amount. Our last community outreach that we had, it was majorly funded by the team members of the club. But recently, we recruited new members into the club, and we are trying to put in a structure whereby there will be amounts that will be, of course, there will be there will be contributions from new members. So that's still what we are trying to structure in for now. But presently, we don't charge any amounts. Thank you.
Okay. Okay. So, sorry, Joshua, do you guys have any amount in mind at the moment that you can share with us? Like, what are your projections regarding what you want to charge in membership fee? Or are there any rules in your university or in your faculty that affects that?
No, there is no rule that gives a limit to the amount we can charge. But of course, we will try to make it affordable to the students because we understand the state of things in school and the like. So we'll try to make it affordable. We've not agreed on any amount for now.
Okay, thank you so much. So, is there anyone else who wants to share with us how much
Yeah.
they charge in the Student One Health Club?
I see a hand from Nabila. So I will
Okay.
unmute. Okay, you're on mute.
Thank you so much, guys. Yes. So basically, what we did is this One Health Club for us is newly created. Before that, we were working through the IVSA, so that's the International Veterinary Student Association. For those who don't know, what we have is, I don't know, like it's going to take a bit of time to explain, but we have an account through the university instead of having our own account. So different clubs and societies on campus have cost centers, that's what they're called. And the cost centers are run by the university. Each different club and society for every different faculty in the university has a cost center. So you don't work with your own bank account, just so that we are protected from things like fraud, and I have no idea what else actually. So all the different clubs and societies of all the faculties are managed ultimately by something called the SRC. So IVSA is one of the clubs and societies, and we are all managed by the SRC. They're basically like a link between all the students at university and the faculty, the university staff itself, and they oversee all the cost centers. They make sure that you are spending if you need to spend. If you're not spending, they have the right to reabsorb some of your money and redistribute it to other clubs and societies who have gone overspent and stuff like that. So it's a really big system. If you want to know more about it later, I can try to provide information at a later stage via email or something. So we have this cost center. But when it comes to One Health initiatives, for example, the initiative I spoke about at the introduction, the Maverick initiative, we haven't really had to spend money because the things we need are, for example, the drugs. If we're going to do an outreach, we need a vet to supervise. And supervision has come so far from the faculty as well as from state clinics. So state clinics usually provide their own drugs when they come. And I think by some way, they're able to log the outreach time that they're with us under outreach hours that they're supposed to complete. So it happens to work out for us that way. If we do have to buy, then we do try to make a way using our cost center. We have money there usually from fundraising or anything like that. But usually for drugs and stuff, we don't have to. The only thing we usually pay for is a bus to take all our volunteer students that sign up for the outreach from university to the area. And most of the sponsorship for these things come from Hills Science Plan, as well as Royal Canin, they've been two very strong sponsors at our university, so you might want to reach out to them. The only thing that's complicated the issue is that in doing that, they are very concerned about branding, and that's something that gets a bit touchy because they will say, okay, when they come, they want to distribute things, for example, like bandanas or pens or whatever it is they want to distribute. But what we've noticed, and other vets that are very involved in community outreach have told us, is that when you go out and the brands want to hand things out, we don't realize that when we leave, children might fight amongst each other for the things that we've handed out, or bigger kids might pick on the little kids and steal from them or whatever it is. So that happens quite a bit. So it's always that give and take, and you have to analyze very carefully what you can actually give the sponsors if they would like anything. The other thing we did have as well is once a company had sponsored us for a certain initiative and then went and marketed it as completely their own initiative, and that wasn't okay. So yeah, just in terms of funding, that's where we get stuff from, but also just always be careful about what sponsors would like, because sometimes they say something and then show up and do something else.
Okay, thank you. So I think Peter, you forgot to tell us how you manage the funds that your members submit to you. Do you have a bank account like for the association, or do you still use somebody's personal bank account to manage the funds? How do you go about the banking for your student one health club? I'm talking of Peter that spoke from Kenya, the one that said students pay 200 Kenya shillings. Andreas, can you unmute him? Let him tell us how the bank in their institution.
Okay, from our institution, we actually don't run a bank account. We use someone's account where we keep the funds, but then we have to keep track with the financial records, whereby we get monthly reports, and then but we are hoping soon maybe we could be able to open account. We were advised by our dean not to open account at this early stage, but we hope we could get one soon to make it easier to manage our funds.
Okay, thank you very much. So, Andreas, do we have any other hand? Does anybody else want to tell us how much they charge and how they conduct the banking with their student one L club, one L student
Yes,
club?
we have a hand.
Okay, okay, who's that?
Latika Abdul Kamil.
Okay, okay, good. From University of Ilorin.
You can just press on your microphone to unmute yourself.
Okay. Good evening again. So at the Students Club in University of Ilorin, Nigeria, presently we don't really charge our members yet, and we're actually working towards it. We've not charged them yet because we are trying to create a form of awareness about One Health. You find that most times when you charge students money to join an organization, they shy away from it. I don't know if it's just here. So we're trying to make them see the reason why they should actually advocate for One Health and why they should be members, and see what exactly we're offering them. Then afterwards, we're going to bring in the membership fee. But for the programs we've held so far, we have support from some of the lecturers in public health department, veterinary medicine, and they actually donate to us most times, so we get that for our programs. Then we also sometimes don't need much, especially if we're doing online programs. Then the on-site, we sometimes just get donations, or we partner with other organizations that are well established, and we just maybe give them more or less like manpower support, and we collaborate to just organize the program. So that's how we've been doing we've been running the organization
Okay,
so
thank you
far.
so much, Latifa. That's a very nice thing. I think that's similar to what Nabila said when it comes to partnership with other organizations. Since we're in the same
Yes.
region, we don't expect much difference actually. So, and I hope the people that wants to start up One Health Club in their universities are hearing this and they're learning from it. And yeah, obviously, I hope this will help them. So, Andreas, I think we have two more hands, right?
Yes. The next is Abubakar Madi.
Okay, so Abubakar, can you unmute yourself and talk?
Just press on the microphone and you are self-muted. Maybe I said your name wrong.
Okay.
Abubakar Umar
So
Zidane Madi.
no, it's Abubakar Mande. It's not a problem. Do we have any other hand up? Maybe
Yes.
he's having problem unmuting himself. So you can unmute that other person while Abubakar sorts himself out.
Hello, can you hear me?
Okay, yeah, we
Yes,
can
we
hear you
can.
now.
Hello, okay. I'm Abakar Omar Gidamadi, though I'm a graduate, but of course we do participate in things like that. I think this thing might help students in actually organizing their clubs and also trying to source funds. In our clinic here, we do tax our staffs. The clinic is government clinic where the funding is expected from the government, though the government is not actually doing what is expected. So what we are doing here is that we task our members that each and every member or the staff there should give, like say, 5,000. And if we gather all the funds, all the money, what we do is we buy all the necessary things like the drugs we use in the clinic, the usables and non-usable materials also we use in the clinics. So that's actually how we source funds to actually cater with our problems and our needs in the clinic. Thank you so much.
Okay, you're welcome, Dr. Abubakar. Andres, do we have any other hand up?
Yes, it's Sabangu.
Okay, can you unmute him?
All right.
Sure,
I have a suggestion based on what everyone mentioned about the financial structuring and how you source out funding. The missing model is sustainability. See, a lot of work that is done in institution does not have a model of revenue generation. What happens when the companies and the government and all these outside members that you approach for funding is no longer interested in funding you? So in a way, I was thinking perhaps, the expansion of One Health as a model, it's based on a principle of emerging properties, right? You are expanding beyond just one field to a skill. The role of a skill is to serve a certain function. So expansion of it from veterinary and medical and all of that into law and policy and all of that. Some groups can actually land a model of consultancy where you can generate revenues for yourself. I mean, I don't believe you need a lot of money to deduce some of the patterns that you see in society, that you can formulate an organization that can consult with government or consult with companies to try and get a model get a model that you can use to generate a bit of income on the side to make it sustainable. I don't know, it's just an opinion.
Okay, thank you so much, Dr. Shabangu. Am I correct?
No, it's Miss Shabangu, sorry.
Okay, so thank you, Ms. Shabangu. Actually, I was going to come to that. It's one of the questions you were supposed to ask, but thank you so much for bringing this up. So, Andreas, do we have any other hand up?
Yes, we have some people. We are going to leave just two more people to talk, so we can move to the next session. So, Elikana.
Okay, thank you.
Okay, I have to unmute you. That's important part. You're self-muted. Okay,
Yes, can you hear me?
Yes, yes.
Okay.
Yes, I just like the discussion of student financing, one is a club resourcing and a way forward. So I had people from Nigeria, ISOHA, what they do. Basically here in Uganda, the club that I run, we just decided not to charge any student fees for membership because as the One Health leader, we were introducing the concept for One Health. So we wanted to get people on the ground first appreciate what actually One Health is. So we were like, charging money will make people shy away because the concept is new. People are getting to know what is this, what is that. So we basically couldn't charge the money. After that, we went to the university administration, that is the people in charge of administration and financing. So we designed a constitution that will run the club. So in this club constitution, we stipulated the law. So we started the financing section, basically the financing secretary who handles money and how much they handle. So we agreed we are going to run the club funded by the university. So the initiatives that we do are funded by the university. And if the university is not willing to fund a given initiative, the university has partners they work with, and sometimes we engage with, and if we present a convincing project, then they are willing to support. So I will shed light, for example, when the One Health Central and East Africa came in, basically through the One Health Next Generation, they were able to support some of the activities. So what we do, we have a project, we have what it's going to do, we have the budgeting. So they would come and say, for example, if you're going out to the communities, then we are giving you, let's say, transport, and they're giving you, let's say, the meals for the people who are doing this work, and then we are giving you like airtime for the coordination. So that was good enough. Very many initiatives like the One Health Central in East Africa, then we had the First Mile project. They were able to support the team to do different activities. Then where else can we get money? Sometimes the leadership of the university through the faculty, they themselves contribute money to the projects, and as the leaders sometimes invest in money so that we have activities done. That's why I was keen to talk about something with COVID, that you have to invest in some of these things, because leadership is basically taking people to where they're supposed to be. So you invest. Now, what would be the sources of funds for other, what would I advise? Most universities, for example, those who are running university projects, university chapters, universities have partners, and these partners are very key in sourcing for finances. They are always interested in student activities. So when you feel like you want to do something, then come on ground, get the team, put the concept, put the project, give a feasible budget that actually works, that will be true, the honesty, the integrity, present it to the top administration, for example, the chapter leader, because every chapter has leaders and each leader has the role they're supposed to do. So, for example, the secretary and the chairperson would be enough to do this. So, present it. Then the partners will see if it's feasible for them, if it satisfies their needs, so they will support you. So how will money be handled? Every chapter has to establish a banking account. For example, this is not money for one person. This is money for a team. So you have leaders, you have the treasurer, you have the finance secretary. So who are going to be in charge of each and every money that you give? So if you're able to present the account through maybe the university grant section, let's say, then people will see that this is feasible and this money is actually going into public hands. They'll give you the money, you do your work. Otherwise, sourcing money would be one of the challenges that these clubs can have, since most of the activities are really lengthy. Thank you.
Okay. Thank you so much. I think one thing that is very obvious here that we all can see is that there are sponsoring and financing modules and everything all over, but these are not sustainable. So I think that that would infer my next question, which will be, I would ask 2 questions moving forward, and those will be the last 2 questions I will be asking for this particular session. The way unfortunately I did not attend the sessions for Europe and South America. I don't know what really happened there when it comes to partnership. But then what we are doing in Africa, what everybody's saying so far is not sustainable. Just like Miss Shabangu said, these organizations, even the universities, sometimes they get tired of funding students. They fund students only when they have excess and when they see value in what the students are doing. What if what you really intend to do, like the budget and everything you pass to them, doesn't thrill them, and it is very important to you? How do you go about it? So we should talk about sustainability when it comes to partnership, what you offer them, the things you can do, other things you can do aside looking for national, international, university-based sponsors, and so on and so forth. There are so many other things you can do, and if you guys have ideas, yes, of course, we are going to be recommending a lot of things moving forward, but then we want to know if you guys have ideas on what One Health student clubs can do, what other things they can do to secure partners, sponsor their projects, and so on and so forth. So I've just asked 2 questions invariably. The first one is, do you think your current sponsorship model is sustainable? So if no, what are the things you are doing to tackle the problem? Then, okay, Andres, thank you. So then, if the sponsorship model you're currently on is not sustainable, do you have suggestions on other things that you can do to generate revenue? One, then secondly, if you do not have, do you really have ideas like things you want to start in the future to get you steady funding? So would like to hear from all the student clubs on this one. So sustainability now, who is going first? Let me ask the questions again. Do you think your current sponsorship model is sustainable? If yes, fine, you can keep it up. But if no, which I expect in many of the cases, because we are all, most of the student representatives that have spoken now, they are all on partnership and university-based sponsorship, which is not always forthcoming. So if it is not sustainable, if your sponsorship model is not sustainable, what are the things you think you can do to get a steady revenue source? So who's going first?
Okay, Nabila, you can go ahead.
Thank you. So I think, like I mentioned earlier, our degree is 6 years, and in the 5th year, there is a One Health module. And I think the best way, if you want to work through it at university level, is to get something in writing put into, what is this, a constitution or into a study guide or something like that. So the approach that I'm going to be taking in the next while is to get our faculty to foster a better relationship with the students through this One Health Club that we've now formed. Because we have this module and we have a One Health department, the head of the department is going to be the supervisor of this club. So it almost feels to the faculty as though this is an extension of them. And then what we're going to do is to try to see through the faculty if they can get it in binding text that this will be they will contribute a certain amount each year to our outreaches or to whatever we need. That's the first thing. The other thing is when it comes to the drugs and stuff, for example, like I said earlier, the state clinics usually provide the drugs. It's better to get it in writing as well, and to try to agree on like a year or a 2-year long contract where they can update that every now and then. I don't know the legalities of this, so it has to be something I have to research, because what's happened sometimes is when the vet changes, then the clinic doesn't necessarily want to participate afterwards, when there's a change of management. So that's something as well that can happen in terms of sustainability. And yeah, I think as long as there's buy-in, you just have to make sure that there's buy-in, and at every chance that you possibly can get whatever you can in writing. That's it.
Okay, thank you so much. But I don't think you really got my question properly. I was asking,
Okay.
what are the things that the student club itself, the One Earth Student Club itself, can do to generate revenue? Everything you said still relates to getting sponsorship from your faculty or your university using
Okay.
paperworks. Yeah, that
Yeah.
doesn't really stand all the time. What if the university said, okay, they understand they've signed a paper with you, but for this year, possibly the government is not funding them the way they used to, or something like that. So for the official proceedings that we are used to using to get funding and support in Africa, there are lapses, and that is why most student organizations at some point you see they become inactive. So what we are saying here is, what are the things that we think the One Earth student clubs can do on their own to generate funding, if you get that properly now?
Okay, I understand it now. Okay, let me
Yep.
think and I'll get back to you.
Okay, so Andreas, do we have any other hand up?
Yes. Rodericky Kiplimo, you can go ahead.
Yes, thank you very much. My name is Rodrigo Kiplimo. Okay, I'm from Kenya, the University of Nairobi. Soik Cubs, I'm a veterinary student. Let me begin with the first part about the funding or how we get funds. We as Soik Cubs yet to become Afro University of Nairobi. For us, okay, yeah, in our part, the funding is not much bad, but for example, we were thinking like during this 2019-2020 year, one of the club members were thinking of something like, for example, in universities you have a lot of engagement with students in matters around foods and then matters around stuffs and all. So we were thinking of where students like running projects like maybe selling in stuff like student shops, so that the money that can be collected there, for example, one students can take one, for example, shop, then they'll be selling stuff to students, all the students' requirements, materials. A small cyber cafe within the school. This can also assist the club to get some funds, like through printing papers for students. Even can run a cyber cafe, snacks, things like that together with papers. So this can be one of the ways to generate. Another thing is like maybe work schools so that like for example, like One Health, we have the triad. So we have privileges to staff like school farms and what have you. So they can be asking for a small share from the school facility so that they can tell them like this share will use to plan this and this to use it in sustainability of the club. So that can be a suggestion about how students themselves can raise funds.
Sorry, I can't hear him anymore. Andreas, can you hear him?
Okay, I'm done. I'm done. That's why I said thank
Okay,
you. I'm
okay,
done.
okay. Thank you so much. I think you made a very important point. So now we have two very cogent things that one else student clubs in other institutions can actually take into consideration while considering a sustainable sponsorship model. The first one, just like Miss Shabangu said, you should think of expanding your reach, expanding your membership to other faculties. One Health is encompassing, it involves almost all disciplines. Why did I say almost? All disciplines, for God's sake. So you shouldn't think about if the One Health Club was initiated by a veterinary student, it doesn't mean the club is only for veterinary students. If it was initiated by a medical student, it doesn't mean it's only for medical students or students in the medical faculty alone or the medical departments. No, you can actually reach out to all departments in the university, get members from them, get their ideas, run projects with them, and yeah, that will also help you when it comes to funding. Because definitely, aside the ideas that they'll be given, when it comes to membership fee and so on, no matter how low the level of compliance you have is, if you have enough number of members, then you'll be able to cover up at any point. The second point, just like the last speaker said, you can actually think of commercializing some programs within your university. If it is allowed by your faculty or your university, you can actually have some programs like some commercial things that you can run to generate fund for the association. That will help because it is more student based. It is more of what the association itself, what the student club itself is doing, and not based on the profit that a company is making, sponsorship that a university is making. No. This time around, it will be from the student club itself and for the student club itself. So it's going to be more sustainable in that way. I understand very well in this part of the world that if you want to have a business as a student club, if you want to commercialize anything within the university, you have to go through a lot, but it's worth it in the end because the sustainability is very key. It will be very bad for the student one health club to run after 3, 4, 5 years and go down in the name of we have run out of sponsorship. That has happened a lot, and we don't want it to happen moving forward. So, do we have any other hand up on this?
We have the hand from Harrison Odhiambo.
Okay. Harrison, you can speak.
You are muted.
Okay. Oh, hello. So my name is Harrison Ochieng. I'm from University of Nairobi, College of Health Sciences, SOIC. Okay, for our case, we aren't that much established, but we have plans for sustainability on our side. The first one is on supplying medical items. So usually in the University of Nairobi, students usually join in August. So I don't know about this year, but probably August and September. So basically, we are targeting medical students and also science-based students. So in the University of Nairobi, we have different colleges. We have College of Health Sciences, we have College of Biological Sciences. So these two colleges are the joining students now, the first years. They usually need lab coats. They usually buy lab coats when they're joining. So basically what we're targeting is as a club, we can buy the lab coats at a cheaper price and then basically resell it to the students, and in the long run we'll make some extra money, some extra profit from the sale of the lab coats. Not only limited to lab coats, can also be selling books, lab coats, books, also be selling stethoscopes and everything. The beauty of it is because in each and every year, students will be joining. Year one will be joining school, students will be joining university and everything. So I really think if it's a long-term project, then it's sustainable. The only limitation is that you have to make early arrangements with the school administration so that they can allow you as a club to sell those items during when the first years are joining. Secondly, we're also planning on probably coming up with a okay, let's basically like a go-to place for students who want to buy medical supplies, medical books, the stethoscopes, patellamas, and everything. But for myself, I really think that's something that's sustainable. It can push us, even though probably the income sources might be depending from sponsors will not show up. Yeah, thank you.
Okay, thank you so much for that. That boils down to what the with the funding rather than depending on external sponsorship from organizations and universities. Thank you very much. So, what Nabila said is also valid. Uh, it can also be a third point in this case because Andreas just notified me that we have just a few minutes more. So I'm going to ask the last question now. But before then, I would just like to give a recap of all we've had so far. So the first one, just like Miss Shabangu said, expanding the the membership base for the club. Second one, having uh, self-initiated commercial projects by the clubs. And the third one that I would like to adopt from Nabila is when signing sponsorship documents and so on with universities and organizations, national, international, and so on, we should put into consideration the timing. We should not make it one off because from all indications, most of the student clubs, not only the 1L student clubs, local student clubs in Africa, what we do is when we have a particular event is when we go out to sponsors, organizations, companies, government, and so on, local government, state government to help us. That is when we have annual events and so on. We should desist from that moving forward. If we want a company, a government, or an organization to sponsor us, we should rather go with a document that will bind them with us for like 5 years or more so that we know that, okay, we'll be getting this sponsorship, but we can spend it on a more cogent and long-term project instead of just for one event and cutting it off afterwards. Thank you very much for all our contributors. I hope the students that are present that want to establish one health club in their universities are learning from this. I hope they're jotting. This will really help them a lot because it's so easy to say we want to have a student one club, but at the end of the day, if you take into consideration the funding aspect and many other aspects of it, it gets very, very difficult. And yeah, that is why it takes many people a lot of years and time on it becomes too difficult and sometimes it's not possible. But it's really possible if you are guided. Thank you so much. So the last question is an interesting one. For those that have been getting sponsorship and so on and partnership and so on, what are the projects or what is the nature of the projects that the partners, the sponsors are most interested in? Are they outreach based? Is it when you want to go for an outreach, is that when you get more sponsors or more partners wanting to collaborate with you? Are they the education based projects? So what type of projects are partners and sponsors more interested in your one clubs? So I will allow Andreas, please, you will spare me this one. I'll allow everybody that wants to speak to talk, and we won't limit it to the time you give me. I'm very sorry about that. I'll be selfish. Sorry. So, does anyone want to talk about that? Like the kind of projects that partners and sponsors are more interested in funding, in supporting, and so on and so forth.
We have a hand from Timothy Oyodare.
Okay.
It's from
Allowing
before,
please.
but maybe he want to talk. I have unmuted.
Yeah, thank you very much. I actually raised my hand for the sponsorship. But with this new question now, I think we always don't have control over the interest of people that will cause sponsors, and they have the liberty to choose their interest. And so, but for anyone that is going to be supportive to One Health initiatives, I think should have developed a lot of interest for some reasons. However, I'm thinking that is a suggestion. Well, before I say my suggestion, I want to ask if this initiative is just supposed to be an extension of universities or institutions and not any other, because I know there are other groups, health groups across nations that are very interested in One Health agenda, but however, not.
If you look at the nature of the One Health concept itself, it's not unilateral, it's multilateral.
Okay.
So it's not a problem for you to incorporate clubs, associations, organizations that are not within your university. It is not compulsorily university-based associations. You can include, especially those organizations that are community-based, you can adopt them as partners. It is not compulsory for them to give you funding. If you have a project that will help the community, you can even support them as well. So that is the concept of One Health, solving public health problems using a multilateral approach, an encompassing approach, one in which you're going to bring together many professions, anything that you can think of. So that is One Health itself. I was being informal in the definition there, but then that is just the concept for you to bring together stakeholders regardless of their background.
It's all right. Well, I think that's a good way forward. Then we can. Just recently, I got to know about a lot of fundings across the globe for different interests, and if we are able to incorporate all these other groups that are not necessarily affiliated to our institution, take for example non-for-profit organizations, they could be very helpful in writing or applying for such fundings that give respect to non-student programs. Take for example the non-for-profit organizations. So I think it's a way forward for us if we are able to see that.
Okay. Thank you so much. If I understand you very well, you're talking about adopt organizations that are not university based as partners, as sponsors, and so on for project execution and so on, and for obtaining sponsorship from international organizations. Thank you very much. That's
That's right.
a very important point as well. So, is there anyone else who wants to talk? Like, what kind of projects are partners and sponsors, national, international, local? What kind of projects are they more interested in funding? This will help other, if you have an experience, yeah, it will help other students clubs, the established ones and the new ones that want to come up. You were saying something?
Yes, we have a hand from Latifa.
Okay.
Yes,
Latifa
hello again. Yes, I actually raised my hand for the sustainability, but I'll just take the two together. So for the
Okay, thank you.
sustainability, I heard most of the ideas everyone was coming up with, mainly business inclined. And I don't know about other places, but over here, I know the vet students are very occupied and they won't really have enough time. We won't have enough time to guard the business. So we may actually have a failing business if we try to launch into business. But there was a point around last year that we got a
she's breaking, right?
connect from someone that was conducting a research, and he was willing to actually present him on rabies. Hello?
Yes, we can hear you.
Hello?
We can hear you.
Hello? Okay, so he was conducting a research on rabies. He wanted to know the incidence rate of rabies. That was what their research was based on. So they wanted something like participatory epidemiology. And our members were able to help them. We went from community to community, helping them get data. And at the end of the program, they actually gave us some donation. So I think other student clubs can actually imbibe this. We're trying to look for more research institutes or researchers to connect with, so that we can actually help them if they need interns for their research. We're giving them a service. We're giving them a service in payment. They also give us a service. So they donate to us and we give them a service. And I think this would actually help in the sense that the students are gaining, because research work, they're actually getting knowledge. So they will be interested in helping because they are getting something. And these people will be getting also people to help them. And we are actually getting money for the organization. So I think that's one of the things that we can actually also think about. Then in terms of income and what we've noticed sponsors prefer to indulge in, we've noticed that if you have an outreach program, most times you have more sponsors, or you have people that are willing to donate more than when you have an educational program. Most educational programs, you can't, sometimes you can't even raise enough to get a hall unless you're doing it in campus and you just get a free hall. You just have to source within yourself. But if it's an outreach, before you know it, you get people that are willing to donate materials, people willing to donate refreshments, people willing to take this and that, and you get everything you need immediately. So outreaches have it. You always get enough sponsorship for outreaches, more than you get for other programs like education and all.
Thank you so much, Miss Latifa. So you made a very good point. But the first thing you said, vet students are very occupied, so they won't be able to manage the business. That will take me to what Miss Shabangu said. Why not expand?
Yes.
It's not compulsory for
Oh
the One Health
yes,
Club to have
we
only vet students in it.
our organization. Our
Okay,
organization
I
has
can hear you.
members from other faculties too. We have members from pharmacy, we have anatomy, we even have from health education, educationists. But the problem is university students always have a lot that they are working on. And if you want to start a business, you need a lot of dedication. So in the end, you're going to have just a few people running the business. And those people, when they get tired or when they leave, maybe when they graduate, how are you sure the people coming behind will give as much dedication to the business as you did? But when this service is actually giving them something in return, they're actually gaining from the service they are given. They're helping someone with a research, but they are gaining from that. Then they would actually be willing to give that time, sacrifice that time to be there at that time. That's
Okay.
what the point I'm trying to
Thank you
make.
so much for that. We understand that university students are always busy, and there's a way about that. You can make your business a project, such that, for example, someone mentioned getting lab coats and selling it to your new members. What you can do on that is you will know the source, like where you get the lab coats from. You know the price, and you will have the phone number, the contacts of the person you're getting it from somewhere. So it doesn't have to be the same person that went to him last year that will come this year. It's business. It's only the income that matters. So whether last year or this year or coming year, what matters is contacting that person that, okay, this year we have so number of students and we need so number of lab coats. We give you the money, you sell it to the students, you make your profit. So if it depends on how you design the business. That is what will yeah, that is on a business note, but this is one health. It encompasses everything. So that is just it. If I understand, health students normally have a bulky curriculum and so on and so forth, but people in social sciences, their curriculum is not so bulky. I don't mean to belittle their curriculum that they would have time, but even if they don't have time, I just say something. You can design the business such that it will be sustainable. And there are lots of businesses. It's not all of them that requires persistent attention. The lab coat one I just mentioned, for example, I'm sure there are thousands of other examples like that you can design such that it will be sustainable even after the initiating group graduated, they went away or something like that. So thank you very much. You made a very, very good point. And on that, the other two options we just gave, the one from Nabila and Miss Shabangu, you should consider that as well, expanding so wide that you will have people that can dedicate, no matter how little the time is, for the business, like for sustainable income. And the one from Nabila, the research based income, yes, is a nice thing too, but it might not be forthcoming. You don't know when a researcher will come to seek you up. Yeah, you are not in charge of that. So what if they don't come for a year or something? So why would you be getting income? So yeah, so that is just it. If you, so when you are signing a contract with maybe an organization, it can be a research institute as well. You should consider a long term pact rather than a project based one. If you have a researcher from a research institute, why not contact the research institute he or she is coming from? Okay, anytime you send researchers, we will help them once we have the evidence that, okay, yes, they are from your institution. But for the next 5 years, we are getting $1,000 a year from you. Henceforth, you can send researchers to our community to help you. That is also a very nice deal, I think, that can work. So I'm not saying that is what everybody should do, but it's just an idea. We are here to share with one another possibilities of moving forward with One Health. Thank you so much. So is there any other hand up?
Yes, there is one hand, but probably we're going to move to the next session because we're out of time.
Yes,
And
yes. Thank you very much, Andres.
thank you very much for moderating.
Okay,
So
so
the
I
next
believe
session is
everybody.
about future of ISOHA. As we said before at the beginning, we changed the EXCO members in the past days. And now the future is coming for you to participate as official members of ISOHA. I mean, we are planning to open applications for continent representatives, and we are planning to open some positions for the educational committee members and maybe some secretariats. So here is the chance for you to participate more actively on this international One Health club and give your inputs more actively. So I will make all my questions together because I know that it's 2 hours almost now and maybe you are tired. So when you can answer to any of the questions you want. So as the next year president, I know personally that I can give you some things that I have planned to do. For example, one of my dreams is to come in contact separately with each One Health club to see what is your situation and how you move there and what we can do for you. But my dreams are not enough to cover everything you want. So here we are today to hear your dreams about what ISOHA can do for you. So I would like to hear what ISOHA could provide to you as One Health Clubs. I mean, right now we have some maps that we showed you before. We have the educational webinars. We have the Who is Who webinars that this year is continental. And we have our journal coming soon. It's the first time, so we had some delays and some other projects running for you. So what else could be done to make things better? Another thing to provide you more knowledge on One Health to you and your members. So another thing I would like to hear from you is how we can bring you together in better contact each other. Um, how we can make better these conversations, how we can make the communications better. I saw also a very nice question here. Are we going to be in touch? Because you text me some questions. Are we going to be in touch after this meeting? Yes, we're planning to provide each other your emails and your data, and also you can find them on the spreadsheet you sign, and you can come in contact and exchange ideas. And another question here was, um, can we create a One Health club? I heard TAs, for example, said that they don't have one there, and she's coming here to hear what is going to happen and see how she can move there. So we have structured a document for that, and whenever you are interested, we can provide that document to you, and of course we will share it on social media. Don't forget to follow our social media to get everything we have for you. And now it's your time to talk and give your ideas on that. Just let me check for hands. I have a question. Okay, you can hear the bell ringing. It's 9. So we have one hand from Rodriki Kiplimo. I will unmute you. Press your microphone so you can talk.
Hello, can you hear me?
Yes, we can. We hear you. You can talk.
Okay, let me go at it once. So once again, I'm Rodrigo Kipimo. So about what I think according to me, okay, and this okay, I let me continue. So what I was saying about the future of ISO. So according to me, maybe my suggestions will mainly be post-COVID, but at least now with COVID, we can continue with the virtual discussions as we plan. About the future, I was thinking of something like, since now we have executive bodies across Africa, the leadership of the likes of King Andreas, we can organize within our various disciplines, maybe like students from medicine schools or the exchange programs within Africa. Veterinary schools, the same things, maybe like we veterinarians in Kenya can decide to partner with maybe those in Nigeria. The same thing to environmentalists. So through this way, the school, since we are doing these exchange programs within our different disciplines, the schools can assist us to facilitate this. And then through that now, enhance our power of One Health, because through that facilitation, we'll be exchanging ideas, we'll be working through One Health future, and through that, we'll have enhanced our networking aspects. Another thing is, for example, things like now, even the leadership or the other programs, this can be done through, you can look, for example, country representatives. So, for example, in Kenya, Nigeria, and all the African countries that we have, and have a representative who will be communicating with this executive and being told about the progresses that are happening on top there. And then this can be disseminated downwards to the students, so that students can participate in these various ways. Any other means that is available. So that's my suggestion. And I want to thank you all for this, because I think this will be my last talk. So thank you all.
Thank you very much. We have a hand from Simon. You are self-muted.
Thank you for this opportunity. I had one suggestion in addition to what Rodrigue just mentioned. I would suggest that maybe we can have ISOHA organized conference. This could be annual, where all SOHICs in all the countries, maybe let's say in Africa, can participate in such a conference, and these students can come, or organizations can come and present their projects, whatever activities they have been undertaking throughout the year, or maybe research study that they have conducted within that year. We can have a conference where they come and present such, and this can provide us with an interactive session where people can network and meet there, and it could be a good move. Thank you.
Thank you very much. Actually, yes, this is the purpose of this meeting today. This year, we decided to make some other points, to emphasize on other points than to hear on projects that the teams are doing, so to make the conversation more fruitful. But yes, for sure, next year we need to give more time on this part as you have a lot to say. So let's see who is next. Sabangu.
Okay, thank you.
We can hear you.
The role of the overall One Health organization, I remember Andres, I mean, initially there was no African subdivision unless if I wasn't aware of it, but I was usually in contact directly with you. And I was thinking, you know, there's a room for IP commercialization, especially from a global South context. And I saw, like what I see right now with the projects that everyone explained, there's great room for data generation because everyone is in contact with people, everyone is in contact with animals, all these faculties are together. So there will be data generation in terms of specific patterns that are reoccurring in societies. So the role of the overall African One Health body would be to find a mechanism to retain this knowledge and have a mode of commercialization, you know, through the support of the One Health bodies in the global north, for instance. And I was thinking, you know, maybe because I could be biased because of my passion in academia, it could start with a subdivision that has like a journal-based or a newsletter-based production system, like One Health newsletters that are produced in Kansas State University, you know, that kind of stuff. Because in my assumption, there will be a lot of knowledge that is circulating amongst us, and we won't have a mode of sharing it, meaning we'll be behind in terms of, you know, several ways to solve problems within our little communities. So if there could be, I don't know, I've never seen an example or a company or a business that is fully managed to sort of come up with a model that shows how IP or intellectual property, such as, you know, knowledge generation from social formations is what is going to happen as, you know, all these groups are busy in their communities, busy in their schools and things like that. How can we come up with a model that can help us sustain this knowledge and also generate sustainability from having it? Because I mean, the role of knowledge is to serve. You know, it doesn't help going out in the field, doing what we need to do, coming back, and that's the end of it. You know, and also how do you relay it to bodies outside us in a way that is sustainable? Thank you.
Thank you very much. I will just share my screen to show you this Facebook community that we have, and maybe you can exchange ideas here. There is a platform that people can just, it's a Facebook group, if you don't know it, it's called ISOHA One Health Community. And you can come here and make posts with any One Health educational thing you have or you're doing. Just one more information.
All right, thank you.
So let me check. We have more hands. Yes. Timothy, are you there?
All right, thanks for the privilege. My contribution to the future of ISOHA is is about sustaining human resource, really. It's a student initiative, and everyone is not going to be student forever. So at a time, you're going to leave school. So what's going to be the common platform for everyone to still have an affiliate, I mean, a commitment to their groups or their clubs, because I think for the continuity, the human resource has to be sustained, and if the initiative has started a movement, it shouldn't stop with anyone because the event of leaving school occurred. It should be sustained, and it can only be when those that are graduated still has very good impact and on their clubs where they live. So that's just what prompted my mind. So did you get me?
Yes, thank you very much.
All right.
Andreas, can I go on this one?
Yes.
Okay, thank you. So, as for the fate of ISOHA members when they graduate, so before now, we don't have an established membership system for ISOHA on the international grounds. Local ISOHA groups, local One Health groups, they have established membership system because it's easier for them to control the members they have or anything. But this year, we are trying to create a database for members to not only as a database for us, but to create like a link between all of them where everybody is going to have access. If you need help from someone in one particular institution, you can always refer back to that database, check their contacts, and communicate with them. So, our plan is not only to accommodate present students, like present IVSA members, but also people that have graduated, but when they were in school, they were part of either a One Health club that is ISOR based or not, like just a general thing. So we are planning on a central membership database, and yeah, when that comes
Okay,
out, you'll definitely see. Thank you.
that'll be great. Thank you.
You're welcome.
Yes, I would add something here about One Health Commission. If you go to One Health Commission website and to ISOHA site too, you can find the platform that you can give your data and you take the newsletter from One Health Commission mainly, and when we have one ISOHA too. This is a nice platform to get information about all One Health happenings, even if you're not a student. And for sure, you can stay in contact with them through One Health Commission. Everybody.
Hey, this is Bailey. I have a note along similar lines. Go back. There we go. Yeah, so we have the resources for several of the things that everyone has been asking about. And, of course, they can continually be updated. And we'll be sure to send them out in the follow-up email, which you should be getting in a few days. But we have a spreadsheet that lists, Andreas, if you go a few slides ahead, it will show the link to the spreadsheet. But this is a spreadsheet of all the student groups that we know of in the whole world. So you can use this to contact other student groups in your area. Andreas, can you advance the slides? And so you can use this spreadsheet to contact student groups in your area. Is there a delay with this screen, Andreas?
I just try to find the link. Sorry for delay.
It's okay. There's a slide that shows the map of the student clubs and then the link to the spreadsheet of the student clubs a few slides ahead. So you can use this spreadsheet to connect with other student groups in your area. And then there are 2 listservs, like Andreas was talking about, where you can sign up to get news from the One Health Commission and from ISOHA. So those are a great way to stay in the loop with One Health things after you graduate or after you're no longer a student. So if your email address changes after you're no longer a student, be sure that you sign up again for the One Health Commission listserv with your new email address. And we also have a student group toolkit, which I put in the question box towards the beginning of the webinar, but we'll be able to send that out after the webinar as well. But that is basically a description of how you can start a One Health club. So we hope those things are helpful to you guys. And Andreas, the link to the spreadsheet is it, if you just click the slides forward, it should show that.
Okay, just give me a moment.
And so if you guys have suggestions for these materials after you see them, feel free to let us know and help us just spread the word that they exist, because I think that they are very helpful to everyone, but just not everyone knows that they exist. So, and if your student group is not on this spreadsheet, please be sure to add it. That would really help us out. Thank you.
Thanks, Vale, for the comment. We have some more people here. Latifa? Latifa, you have raised your hand. I mean, are you going to talk?
Okay, hello.
Hello.
Yes. Hello, can you hear me?
Yes,
hello?
yes, we can.
Yes, yes.
Okay, yes. Okay, so I just wanted to make a point. I think ISOHA needs to, what we need to do with ISOHA is, it's supposed to be an overseeing body for all other One Health clubs around the world. And there needs to be some form of a guideline for other clubs, upcoming clubs and already established clubs, to know what exactly they want to do, what exactly is expected of them. For example, when we started at the University of Ilorin, we had we knew what we wanted to do. We wanted to institute One Health. There has been none before in our country, almost in the whole region, but we wanted to do something about it. And we had problem finding these resources. That was before this toolkit was created, the toolkit Billy talked about earlier. But now the toolkit, I looked through it a while, and I think there is no firm grasp of what exactly I want to do. Like what my vision is supposed to be. We're trying to create One Health, One Medicine, but are we trying to do it? Are we trying to make? Are we trying to go through education, through outreaches? What impact do we want to create? When the students that were members of ISOHA graduate, we want them to have this form of unity between all the fields. But how exactly do we plan to achieve that? If you just come up, you have a student club and you keep going for outreaches, and these people have no idea what One Health is about, I think we're just going about the problem we're trying to solve the wrong way. I know some people have programs and everything, but they still don't have a firm grasp of what One Health is, even what disciplines are supposed to be encompassed in their clubs. So if ISOHA can actually create this form of guideline, so that if you're coming in, yes, you're not just going to create your One Health club and start going for outreaches on Tuberculosis Day and microbial resistance, you're going to educate yourselves. Even if you can't go for outreaches, educate the people involved, educate your members, so your member can stand anywhere and talk about One Health. Your member can stand anywhere and say, yes, we know what infection prevention control is about on this disease. Yes, if they talk about this problem, they know how to talk about it effectively. I think we need to focus. ISOHA needs to try to make other clubs focus on education more than outreach, because we're trying to impact the future of health and we're impacting those youths. So we're not just a body that is creating or organizing outreaches and all. We're trying to impact ourselves. So I think we should also focus on that. If we can do that, then we would have maybe little problem with what. Hello?
Yeah, we can hear
Hello?
you.
I think I'm on mute.
We can
Okay,
still hear you.
if we could do that, then we would have little or no problem with actually.
okay, we would have little or no problem with reaching out to the world, because most of the problem we have over here in Nigeria is education. Some disciplines don't even know the existence of One Health before the advent of COVID-19. And that is a huge problem. I don't know if it's just here or if it's in the whole of Africa, but I know that is a problem and we need to bridge it. And the only way we can bridge it is if a body that is solid enough. If I just come forward and I tell you I'm Unilosari member and all that, they may not really give me a lot of attention. But if I have a solid backing from an international organization, they may actually look and listen to what I have to say at Unilosari level. Thank you.
Thank you
Yes,
very
I
much.
think that's a good point, that our clubs focus. I think that's a good point that our clubs need to be focused on One Health education. And in the chat box, I just sent a link to the One Hope initiative, which is a group of people who focus on One Health education in different spheres within their region. So I know that One Hope in Africa is very involved. So that would be a good resource to connect with if you're looking for activities for your clubs.
So we have another hand from Abdullah Jumail. Sorry.
Hello, can you hear me?
Yes, yes.
Yeah, in relation to what Ms. Latifa said, I think One Health has the mentor-mentee program as well, if I'm correct, right?
Yes, exactly.
Yeah, but then I don't think it's as active as expected, because basically I'm one of the mentors, but I don't see it as effective as as it's supposed to be, because like we couldn't even get to contact the students or the so-called mentees who should be mentored. So I feel like if there are ways whereby such program can be made to be more effective, you understand, with that, the channeling or circulation or dissemination of like One Health knowledge will be much more profound and remarkable. I'm not sure if you understand me.
Yes, yes, I think we get it.
Yeah, let's just try to make that working better.
It started the previous year, the mentorship program, and I think it went very well for first year. And this year we tried to introduce in the program some new stages, as probably you have seen. There is always the possibility of mistakes and difficulties, but you are always welcome to text us and try to find solutions together.
Okay.
Have a hand from Simon, if you're not going to add something.
Say again?
If you don't have something to add, then we have a hand from Simon.
Yeah, sure, you can move on.
Simon, you are self-muted. I saw before a hand from Nabila. I don't know if still having something to say. You are on mute.
No, I think it was just to elaborate. I think I'm not sure of the name of the person who spoke about the education versus the outreach mentality thing, but it was such an important point, because just a small point for me to share is that a lot of our students jump onto the bus when coming to outreaches just because they get more practical hands-on experience, and then the whole educational aspect of One Health gets thrown out the window. The one challenge that we face is trying to find students who are actually passionate about One Health. And I think that's where in our faculties we have to drive that message home again, because our students are really just focused on what they are interested in. And I think that we need to remind everybody as professionals in any system that One Health should be on your radar at some point or the other. So thank you for that point. That was a brilliant point.
So thank you very much. And thank you everybody for participating in this conversation. I was sure that it will be a very nice conversation and that we are going to have a real points here. We just finished, but don't hesitate to contact us for any other thing you may need from us, or anything, any idea you have, or on ways that we can help you. Here is our ISOHA Expo email. We can bring you in contact with your content representatives if you need anything. Yes, and we have to thank very much the One Health Commission for providing us the GoToWebinar platform today, so we can come all together. And I think this is the end of our meeting. So nice to meet you, and we will be in contact for sure. We will hold all your notes, all the notes of this meeting today, and we are going to do our best to make them your dreams reality. Thank you very much. Have a nice evening.
And you too. Thank you.
Thanks, everyone.
Thank you.
Thank you. Good night.
Thank you guys for organizing. We'll catch up again.